Welcome back to You Heard It Here with Dr. Gary. This is Earwax Removal Vlog number 121. In today's episode, we're going to look at a compilation of a couple of different patients' ears. Our first one, I can't tell if this is just a forest of hair or if there's a ton of wax, or both. I'm leaning towards both because the patient reports not being able to hear, even though they recently, as in within the last 6 months, had their hearing tested, so we know that their hearing was actually pretty good. As we dig through that hair and push it aside with the curette, we're able to see quite a bit of wax, and we're going to use the curette to gently and slowly remove this earwax that's all tangled up in the hair like a bird's nest. If you like these wax removal videos, please take a moment to like and subscribe. It really does help with the YouTube algorithm, and it helps keep me motivated to put out this content. Okay, as you can see, as we look down there, it's a little more difficult to do this wax removal compared to some of the other ones because the hair is so thick. I've never had a patient actually wax their ear hair, but it might not be a bad idea for this one. As this wax comes out, it's coming out in one giant chunk. The hair is helping to hold it all together, and we're going to get a beautifully satisfying piece out of that. Look at that. That is a giant chunk of wax. I'm going to hold it here next to the curette, clean off the camera. You get a good view of just how much that is. You can actually see the hair intertwined with the wax and dead skin that hold it all together, making it like an earplug for this patient. As we look back down the ear canal, we still see some hair and wax down there, but it's not nearly as bad as it was. We can see the eardrum on the right side, and it looks pretty healthy, all things considered. We're just going to use the curette here to finish cleaning up this ear canal, and even with how much we took out, it's amazing how much more is still coming out of that ear. Again, now we can see the whole eardrum, but you can definitely see lots of hair down there. All right, now we're going to go over the other side for this patient, and we see just as much hair. Again, we have to get through the hair and then through the wax in order to pop this out and get it clean and clear for the patient so they can resume their normal communicative life where they can hear pretty well. We're hoping for another large skin ribbon and chunk of earwax to come out all together. But man, it really is like diving through a forest here with all this ear hair. If there's any topics that you'd like me to cover in these earwax removal videos, please leave a comment in the comment section below. I really do try to take the comments into account and really let our patients and let our viewers kind of guide where this channel goes. All right, as we look back down, we still have a little bit more in the way of hair in the way, but we can see the eardrum. So that's really good. We just need to remove this bird's nest. Here's my disclaimer. Again, this is not medical advice. This video is intended for education and entertainment purposes only. If you like these videos, remember to like and subscribe, leave a comment, but this is not medical advice. And look at that. After everything else that we pulled out, we had another huge chunk or glob of hair mixed with that wax. As we look back down now, we have a beautiful view of the eardrum. It looks very healthy. This patient is good to go. This has been You Heard It Here with Dr. Gary. Thank you for watching. I'll see you in the next video.